My name is Aisha Brima. I'm 36 and I have sickle cell type SS. When I was a kid, I would get sick every 3 months. So then you could kind of schedule things around that. But now I get sick so often, I'm pretty much go home, pay my bills, and I'm right back in the hospital. I spend 95% of my time in the hospital. I've taken all the treatments they've had for sickle cell. I've always wanted to work with sickle cell, but I've never had a work history. My sickle cell is too severe for me to work. It's even messed with me going to school. I've been associated with Candace's Sickle Cell Fund about 15 to 16 years. I really like the fact that there's a support group when I get out the hospital, and they'll supply meals for me when I first get out, so until I get back on my feet and can start cooking again. We've gone out for massages, taken me out on birthday, like for dinner. They also have supplied Ubers for me at times when I couldn't get to doctor's appointments. They have counseling now, which I think is great. Just little things that matter. I think of Candace now as my sister. Some of the people on her board I've actually known since I was little. It's like one family for me.
My name is Aaron Samasi. I'm 31 years old, and I currently suffer from sickle cell SS. My life as a sickle cell patient transitioning from a pediatrics to adult has been very rough. So I have to start by saying I lost my parents at a very early age. My mom was a nurse, so she really knew how to take care of me. I didn't really know much about my health. I just knew I was a sick kid. So I really had to do or learn more about my health all on my own. During my high school years, I developed a vascular necrosis in my shoulders. It is the deterioration of the bone due to the lack of oxygen and blood flow getting there. So for us sickle cell patients, because our C-shaped sickled cells get stuck, the less is gonna have that blood flow. In my hip, I couldn't walk. I ended up having to get a hip replacement. I was in a very dark place and depressive state. Just the fear of things not going right, and it was just a lot of mental stress and anxiety. Candace's Sickle Cell Fund has an advocacy program where sickle cell members can become advocates. First, I'm like, hey, I'm not here for no therapist or something like that. I don't think I need that. But that's also a stigma in the Black community that we don't need the mental health or therapy or whatnot. But because I thought about the stigma, I'm like, you know what? I'll take it. We're doing wellness checks. The wellness checks, are you hungry? We can support with food. We can see what kind of mental space you're in. So we're just gonna try to alleviate as much pressure that you feel as possible because we went through the same thing, or we feel that pain. Another thing too was, because of Candace's Sickle Cell Fund, I was able to find caseworkers, social workers, helping me straighten out every aspect of hey, your health insurance is lapsing. Okay, we can do that reapplication for you. Things that I didn't know how to navigate before, I'm learning how to navigate now thanks to her help. I was lost as a sickle cell patient without a sickle cell group. Now you have a source now of where you can ask, where to go to. It's deeper than just the help you get for yourself. It's helping for other people as well, other patients as well.
My name is Juragni Alberto. I'm 30 years old and I have sickle cell SS. I had a struggle when I was 21. I remember I was in school. As a person with sickle cell and also living in the projects, we don't really have a lot of, money to be paying for a private school. So I decided to get, jobs to help for my own education. I was having 2 jobs. So I guess through all this sickness and also the stress and the school and the payments, I got to the point that my body was telling me take a break, but I never listened. All the crisis, all the pain was a lot for me, physically and also mentally, I was at the point that I was really depressed, I don't really want to do anything. That led to me to let go to school, leave work and focus on my health. I met Candace in the sickle cell walk. She can give some pain relief, to the people with sickle cell. I remember one time I was looking for somebody to take care of my son, and like everybody's working. I had to be in the hospital for like 6 hours, 8 hours getting a blood transfusion. So at that moment, I really needed help. And she offered, to look for a babysitter, to pay for the babysitter. So she's a person that you always can call or trust no matter what, like anytime. I feel very, very lucky have Candice that had the support for us.